Okay, so I'd like to introduce Tiffany, who's going to take it from here.
Hello, everyone. Thanks for coming. Jennifer's going to be my driver. So we want to talk about the portal and go over it a little bit because that's how you will be doing your enrollment for the students this semester. Most of you, I think, are already all set up and have been using the portal. If you have not, then we'll make sure we get guides out to everybody also. If you have issues with logging on with your username and your password, please reach out to Taylor and she can help you get either set up or your password fixed or whatever the case may be. And you'll just go to EMI Help's website. You'll come to this screen here. You'll go into the sign in. You'll use your username and your password. Now, you have also, if you are reviewing the bill along with the enrollment, when you log in, you should see two options. You'll have your EMI Health or you'll have your bill pay. If your bill pay, if you've already put them, you merge them together, then you'll see the two. If you're still logging in separate, you can put the two together so you only have this one dashboard you have to log into. And that's your preference, however you want to do it. If you need to have access to the bill and that's not something that you're getting, then we need to get you set up with our accounting department. And that's something also that you can get to Taylor. And she'll work with our accounting team and our marketing team to get that updated. So when you get to this dashboard, you want to click on My EMI Help. It's going to take you to a new dashboard, which is our portal for the eligibility. It'll show you that you're in your welcome page with your username. You'll want to go in the enrollment, put your cursor over enrollment, and then go to the perform enrollment. Now, right now, most of you will not see the open enrollment option, and I have not set that up yet because I'm still working with our billing team to finish out the last year's billing. So when everything's good to go, you will see the open enrollment option. So right now, you're probably only seeing new hire or changes. And what you want to do is for the open enrollment, you want to just use the open enrollment if the student's already been enrolled in the program. So my suggestion is always to go through the open enrollment option first. And then you have multiple ways to look up the student. Under patient ID, you can look up the student ID number and then click on search. If something comes up, then you know the student's been in the system before. So you want to continue to use this record and use the open enrollment option. If they're not in, then we will show you how to do a new enrollment as well. So anything that has, so for instance, Jennifer just added a patient ID or the student ID that's not in our system. So for right now, we will stick with the open enrollment option. And if you see anything with that orange that's a hyperlink, you can click on that. It's going to bring up the student's record. So everything already will be, oh, you're in the search. Go back to the home page. Yeah, okay. So right. Okay. Okay, so this is where it will bring up the eligibility screens where you will enroll the student as an open enrollment option. So it's already going to have everything pre-enrolled. Now, what we will do is we're going to go in and terminate all of the students. The reason why we do that is because we like to start off with a fresh enrollment. That way we don't have to worry about getting terminations to us. We only enroll the people that are active. So when you're first enrolling, you're going to come to this screen and you're going to see the status is going to be termination. So that's where you'll want to flip that to active. And we always want the email address. So that our email address should already be there. Also, under the Alt ID one, that's where you'll see the student ID. So you can search off of name, you can search off of member ID, you can search off of social. The reason why we're asking you to do a search by the alternate ID, which is the student number, is because there's some students that are out of the country, and they're not enrolling with their original social security number at the beginning. And if you go in and change that, we had some students enroll last semester that because we changed the social, it duplicated their enrollment. So we were billing that student twice on your bill. So we want to make sure that you're not changing the social security number. And we'll talk more about that when we get a little further on. But you should be able to search by the student ID. And that's going to be the one record that doesn't get changed.
Tiffany, I actually picked a good example because this social is a temporary ID.
Okay.
So we'll actually have a good example this time.
Okay. I think anything starts with the 99 is usually a temporary ID, right? Or at least 19.
I think.
Yeah, I'm not positive about that, but that doesn't matter anyway. Okay, so going further down, you want to flip the terminated to the active. If you do have an email or an address that needs to be updated, you can update it here. And do phone numbers or anything that you need. You'll want to change that employment from terminated to active also. And then right there where the location is, that's the one thing you have to be really, really careful about, because if you're getting a student from one of your departments to another department, this is where you'll want to update it for the new year. So if it has a 1 and they're going to your department now that is possibly department 26, you want to pick the 26. We do have a list that we can give you that tells you which department number belongs to which department. And I believe, Jennifer, you were saying the same department number is the same one they use for the medical?
It is. The insurance locations are the same for both our United Healthcare and EMI. So those of you that do department enrolled insurance and you have that the United Healthcare template, on the second spreadsheet of that template lists all the department numbers too.
We can still get you a list just so you know what your department or location is. And then the other information is already pre-populated, so you don't have to change any of that. So the main things on the screen is flipping it from terminated to active. Apologize. From flipping it from terminated to active, and then also making sure you have the correct location. And then you just hit save and continue. And if you have dependents that need to be enrolled, the student has dependents they're wanting to enroll, this is where you would add the dependents. But for right now, we'll talk about that in a minute also. So right now, we're just going to mark on the top box or the bottom box that says, I do not have any dependents. And then you will click on save and continue. This also will be pre-populated if you're using the open enrollment function. And it's going to already show that they're medical, or sorry, dental and vision.
I actually have just a quick question about the date of hire. Because it said that all the other stuff is populated, but does that new change to 866 is the date hire and enrollment, or should we leave that as well?
So when
Or
you're
they already,
so on the open enrollment option. So are you talking about the new hire date that was already
yeah,
pre-populated?
well, and also the page prior, it said date of hire, and then it had
Yeah.
1/1
Yeah.
2022.
Yeah, you don't need to touch that.
Okay,
The open enrollment function already has the date of August 16th that it
Okay.
will automatically pull over.
okay, all right, thank you.
Yeah, no, that was a great question. Thanks for bringing that up.
I believe that like our data hire is the date that the student became eligible for insurance. This is the location number 1 student. So she became, or this student became eligible on January 1st. And this is the date that her, that starts the clock for any of the wait periods that are associated with the EMI insurance. So you really don't want to change this date, correct, Tiffany? Because that's the wait period start time.
No.
Oh, it's not.
Well, okay, let me tell you. So yes, you're correct as far as it usually does reflect the beginning of their original effective date. And yes, if they were to try to figure out what their waiting periods would be, that most likely might be the correct date. But that's not tied to the waiting period functionality. That's something that we do outside of this system and do it in our main system. But usually you will see that when their coverage is beginning for the first time, and that will just stay that date. There's no reason to change it. But it does not dictate whether or not they have a waiting period. That the system doesn't calculate it off of that. Okay, so here's the dental and vision again. And it will already be pre-populated because again, you're just doing an open enrollment option. If you're doing a brand new person, that's something that you have to fill in, but we'll go over that more.
I know. This is whatever they're saying in this training is also not urgent.
Okay.
Yeah, so I'm multitasking.
Oh, you're hopping on the.
EMI enrollment.
And so
Yeah.
can you mute yourself?
Sorry.
You're
Awkward.
fine. Leslie, can you mute yourself?
Okay, thank you. So this is the dental and vision. So we can hit save and continue. This is your review page. So on the right-hand side there, you can see the edit option. So if by chance you need to go in and edit because you forgot to change the location, or you noticed that the address wasn't updated or something like that, you can click on the edit. It'll take you back to that section of the enrollment process. And it will, that's where you can go in and change anything that you need to update. At the bottom, you just hit save again and it'll take you back to the review page. So you just want to make sure that you did what you needed to do to get that student enrolled under your location. At the very bottom, you're going to put first and last name of yourself. You don't want to do the student. We want to see who did the enrollment process. Now, in the comment box, what we ask in the comment box is if by chance you have one of the students that is changing the social security number to their permanent social security number now, we decided to have you put that information in this comment box so that Taylor can make that change when she goes through her approval process. So we don't want you to change it because it will enroll the student one more time, and we don't want to do that. So if you have something like that that has to be updated, the social, then we ask that you put it here in the comment box. Also, another reason why we could use this comment box is if you're enrolling dependents. So if your department is covering dependents to be covered, you could just put in here that you're enrolling the dependents and the department you work in will pay for the premium. If the student wants to enroll dependents, we need you to tell us that as well. But we need to know that the student is paying the premiums so that we can get a separate enrollment application to get the billing information in our system. So you can enroll the dependents either way. It's just that we need to know who's paying for it. Is the department or is the student? If it's the student, we need an additional application. Does anybody have any questions on that? Okay. And then once this is completed, so you hit submit request, you will not have an option to go back and make any changes at this point. Now, what happens is after you guys approve it, then it goes into Taylor's queue to now review it. And then she will approve it also. Once she approves it, it's going to show, it'll stay out here, just like this one is shown. You can see this one. Those will sit out there until Taylor approves them. Once she approves them, you won't have access to them anymore. And they'll show you who it was submitted by, what type it was, if it was open enrollment or new hire. And then it tells you if when you are doing the enrollment, it's going to show submitted. When Taylor completes it, it's going to show approved. And also when you're seeing those out there, if you see under action, resume, that means you can go back and finish it. So if you get an interruption while you're doing this, or you didn't have information that you're still needing to get, it will sit out there with the option to resume, and it'll take you back to where you left off. And it's kind of a nice function to have in case you're needing to, so you don't forget that that wasn't completed. Now, if it sits out there for a while, Taylor's going to reach out to you and say, this is still out there incomplete. And you're going to decide whether you to delete it or you're going to finish it out. And then at the very end, once Taylor approves those, then they'll be gone. But can you go back in there, Jennifer, into view so I can show them what, no, yeah, into the view. Before you go out of this page, there's an option in the right hand, right there where the arrow is, to print it. And if you want to print it, you can print it, and it's going to give you the option to keep that document. I don't know if you need to keep it. You might want to save it as a PDF in a file. I'm not really sure, but you do have that option, and it prints it really nice, like it's an application that was completed. And then see along the top right there where it says 8/16/2022, right under plan election arrow. That's where it's pulling over the effective date. So that answers the question that we were asked by, I can't remember who asked that question, sorry. And that pulls over because you're already in the open enrollment function, and that automatically pulls that over. So that's how you do the enrollment for a student that already exists under the open enrollment. Does anybody have any questions?
Yeah, do we have a date when we'll actually be able to enter the students? Because their coverage starts the 16th. So there'd be like a gap, right, in coverage, or, I mean, not really, but technically.
So there would be a gap in coverage. I mean,
Right, but if they went to the dentist on the 17th and we still can't enter them, then it will say that they don't have insurance, right?
yes, it will show that they're terminated. So I'm just waiting for billing to get back to me today. And then if everything's a go, then we'll have everything available by tomorrow.
Oh,
And
okay.
we're hoping before the week's even over.
Oh, fantastic. Okay.
Yeah, we're not gonna let it drag on. Absolutely not. So,
All right, thank you.
and plus we want to do it as soon as possible while it's fresh on your mind too.
Marcia has a question.
Yeah, so if a student is eligible for G-SHIP, and so the department is not paying for her EMI, but she has dependents, we have to do the form, and I've never entered them into the system as dependents like you just showed. Can you,
If they're G-SHIP dependents,
yeah,
you're gonna need to send the form into Taylor.
and not add them onto the, okay,
Yeah, yeah. What we were showing was for department paid only. When it comes to dependents on students who are on G-SHIP, with EMI, the dependents follow the student's insurance location. So therefore, any student on G-SHIP who has dependents that the department is paying, those premiums will show up on my bill. And just like we've done in the past several semesters, I will then reach out to the departments for Chartfield so I can charge back those dependent premiums. We'll talk when it comes. So if you have a student on G-SHIP who wants to enroll dependents, regardless if the department's paying or not, those forms need to be sent to Taylor Bell for processing. And once Tiffany gives me the email that open enrollment is open for everybody, I will send an email out to our listserv so you all will know that the portal's ready for 8/16/22 enrollment.
And I'm hoping that's ready tomorrow by the end of the day. Okay, so do we want to, any more questions? Everybody's comfortable with all of that? We also have a guide, so I will make sure that you get the guide, and most of you should already have it if you've already got access. Okay, do we want to do a new one, Jennifer? Okay, so you always want to enroll them with the Social Security number. And then the date of birth. And the employment begin date is really the August 16th date. That should be the date for everybody for this open enrollment. This is where you'll want to populate the information. So it's the same screens that we just went over. It's just that this time they're blank. And we do want the email. That's important for us to get the email so we can send out the welcome email with the information that the students need. We can talk more about that too. And then the gender. Then the Social Security number pulls over from the front screen. The employee member ID, that's a number that our system will generate. So you can leave that one blank. The alternate ID number 1, that's where you want to put the student ID. And you don't want to add the U, you want to just add the 0.
Yes. And then Matthew, can you pop on, when it comes to the email, we'll just talk about this right now. It needs to be the unit@utah.edu.
Yeah, that's correct. We are asked by the university to not be communicating with students through alternative email addresses. So everything should be going to their UMail. There's a lot of reasons for this, including Freedom of Information Act, and we are a state organization. One thing to mention, just as a quick aside, we've not gotten yet to the confirmation emails that the students receive, but if the students have a forward to an external email, then emails that come from a person, matthew.plooster@utah.edu, have a high likelihood of going into the inbox, but no reply at Utah or no reply at EMI have a much higher likelihood of going into spam folders in those alias accounts. So it's very important to encourage students to use their UMail and send everything to UMail and only use UMail on things like insurance.
Okay, thank you. All right. So under the employment status, also the birth date pulled over from the front screen too. That's why that's already pre-populated. And then that can be active, or you have options here. So active, yes, that should be the active. Yep. And in the previous enrollment, that's when you were flipping it from termination to active. So it's the same screens. On the address, once you put in the street address, and then when you go down to the postal code, so the zip code, after you put that in, just tab so that it will populate the other city, state, and all of that information. If you don't tab, then it just leaves it blank. And that's something that's required. You can do a phone number if you have a phone number, then pulls over the effective date of August 16, 2022. Marital status. Okay, employment, that's where you'll want to, you can do active or you can leave, you can do the full-time. I believe the guide tells you to do full-time. Okay, location, again, this is where you want to put your department so that you can make sure that that student gets on your enrollment. The department's not required, only the location. And the data hire can just be the 8/16 date. And Medicare coverage, that's just something that's in our system. It doesn't apply to anything that you guys are doing. So you just put no Medicare. And then the bracket code, that already populates coverage and you can leave that as is. Hit save and continue. Now it brings you to a new page for you to enter if there's a spouse or any dependent children. So we can add a spouse right now, just so you can see what this looks like. Some of the information is already pre-populated from the information you did on the students' screens. Date of birth, active, address is always already pre-populated. And then data hire, which again, just put August 16th. Medicare is no Medicare. And then you just hit save and continue. It's going to bring you to this screen. So as you add the spouse and dependents, it will just keep adding them as you go. If you have additional dependents to add, you just click on that add dependent. Do the child. You go through the same screen. You identify the relationship code to be the child, not the spouse. Date of birth. Again, active. Address is pre-populated. Data hire is August 16th. No Medicare, and then you just hit save. Then it's going to show both of those as listed, and you can keep adding if you need to add, or you click save and continue. Now, on the election page where you want the dental and the vision, now it's not pre-populated, obviously. You always have to click on the boxes to the far left. You want to do coverage option, which is the coverage level. So is it family? You have to mark who you want covered. So that's all three of them. On the vision again, far left, select the coverage level. You put family if you're enrolling all of them. If you don't want the baby on vision, then you would do employee and spouse and not click the little box next to their name. Save and continue. And again, this is your review page. So if you need to edit it, you will see the edit options to the right-hand side. Shows you there the dependent information. Oh, so we clicked on the edit to go back and review that page. And then it takes you back to your review page. You can see who you enrolled on the dental and who you were enrolled in the vision. And again, where you sign, you put your name. And then in this case, because the dependents are added, you need to tell us whether or not it's a department's paying for it, or if the student is required to pay for it. If the student's required to pay for it, I would just say that the application will come through email. And we need the application so we can get the billing information set up. So this will enroll them. That additional information will set up the payments. But it'll be really helpful if you can give us a note so that we don't charge the group when we shouldn't, or charge each department when we shouldn't be. And then submit. And that's the print option right there. And then it shows you there how it looks like it's an enrollment form. And you can save it as a PDF and just put it in a folder or whatever you don't even need to save it. It's just for your own records, just so you know that the enrollment was completed. And then again, this will sit out there until it's approved by Taylor. So now you can see the new hire was enrolled by Jennifer. It was submitted, and now it's just going to wait until Taylor does her part. Once she finishes her process, then you won't see them sitting there any longer. And a question we had earlier is they were asking when they would know if that person was now enrolled for them to work with Jennifer on Department 1. So I just suggested that you can always go out here and do a search, and you can look to see if the enrollment was completed. And that's by going there, and you can look it up by student ID again. And then if that's completed for 8/16, then you know you can do whatever you need to do to give to Jennifer for the students, or whatever your process is for that. Does anybody have any questions now?
Enzo, go ahead.
Sorry about the mic thing first off. Here's my question. How long is this enrolling students for? My question's related to, I have a student in our department who's going to be a GF for fall, and my understanding from the TVP office's communication is they don't qualify for G-SHIP, but they're going to be an RA in the spring. So we wanted to cover them for the fall. And I guess I think this might be implicit. This is enrolling students for the entire year, correct?
Well, not necessarily, because you'll go ahead and enroll the student as of 8/16. And
Mhm.
what's gonna happen is when I do spring enrollment, or my team does spring enrollment for this effective 1/1, I will take that location code and change it to location 1.
Okay, that
Yeah.
makes sense. Okay,
Yes, and then
great.
for your United Healthcare, you'll want to enroll the student for fall only in your department. And then I will take care of enrolling the student in spring, summer under G-SHIP.
Perfect. That answers my question. Thanks so much.
You're welcome. Any other
Okay.
questions?
Okay, so once we enroll the students, we will send out emails to let them know. We call it a welcome email. To let them know that they've been enrolled. We provide them with their member ID so that they can go in and set themselves up on our portal or our website. Now, if they've already been enrolled, they're not going to need to reset themselves up. That portal does not change for them as a member user. So we normally just send the letters out to new students, but this year we're going to send it out to everybody. And if they already have the portal set up for themselves as a user or the mobile app, it's the exact same username and log and password. They don't have two separate logins. And we don't send out cards. They just will log on and look at the card either in the portal website or the mobile app. And we are hoping to be sending those emails out on a weekly basis. I'm not sure how we're gonna, if we're gonna get those out as we enroll them or as a weekly process, because I do have to work with our IT team. And let's see. I think that's about, I'm just looking over my notes. Hold on, please.
And while Tiffany's looking over her notes, we're going to be working with our UIT email team this year to ensure that both United Healthcare and EMI emails are whitelisted so they go into the students' files. I know that there have been some issues in the past, and like Matthew alluded to earlier, that if the student has a proxy or an alias set up, we can't control where that goes, but we're going to ensure that emails from EMI Health appear in the students' inboxes, which they probably have, and the students just haven't seen them. Because we all know how sometimes students can be.
Okay, so we will get, I'll make sure that Jennifer has a guide. But then also, if you don't have a guide and you need one, reach out to Taylor. We're hoping to have everything set up by tomorrow, if not for sure the end of the week, so that you can get started on your enrollment process. If you have questions, please feel free to reach out to Taylor or myself. And if you have any questions.
Amity just thanked us. You're welcome, Amity. If there's no questions or anything, then I'm gonna stop the recording.